Hello, I'm Tomesha Campbell and welcome to our channel. At Enhanced Black Women's Health, we're committed to equipping healthcare providers with the necessary education, training, and resources to promote health equity and address health disparities among Black women. And in this video, we're going to share 3 tips healthcare providers can use to improve maternal health outcomes. But before we dive into those tips, watch until the end for a critical step you can take to improve maternal health. While watching, let us know in the comments below how you're working to improve maternal health outcomes. And let's dive into the 3 tips healthcare providers can use to improve maternal health. Tip number 1 is to provide culturally competent care. Providing culturally competent care means understanding and respecting cultural differences and beliefs and tailoring care accordingly. In practice, this may involve learning about your patient's population's cultural traditions and values and integrating that knowledge into your care. It could also mean using language interpreters or providing translated materials, ensuring that healthcare providers reflect the cultural diversity of the patient population, and being open to learning from patients and their families about their cultural practices and values. Ultimately, culturally competent care involves treating patients with respect, dignity, and understanding, and recognizing their cultural background and how that can affect health outcomes. Tip 2, address social determinants of health. Addressing social determinants of health means identifying and addressing the non-medical factors impacting health outcomes, such as access to healthy food, safe housing, education, and employment opportunities. For example, addressing social determinants of health may involve connecting patients with community resources, such as food banks, housing, assistance, and job training programs. It can also mean advocating for policies and practices that address social determinants of health, such as increasing access to affordable housing or expanding public transportation. By addressing these social determinants of health, healthcare providers can help patients overcome these barriers to good health and improve their overall well-being. Tip 3 is to increase access to care. Increasing access to care means ensuring all patients have timely and affordable access to necessary healthcare services. In practice, this may involve expanding the number of healthcare providers in underserved areas, providing transportation services to patients who have difficulty getting to appointments, or offering telemedicine services to patients who cannot physically travel to a healthcare facility. It can also mean addressing financial barriers to care, such as providing sliding scale fees or connecting patients with insurance or financial assistance programs. By increasing access to care, healthcare providers can ensure that all patients receive the care they need to maintain good health and prevent adverse health outcomes. Thus, improving maternal health outcomes is critical for promoting health equity. And by incorporating these healthcare tips, healthcare providers can provide patient-centered care that promotes health equity for all. So there you have it, 3 tips for improving maternal health outcomes and promoting health equity. Healthcare providers can positively impact maternal health outcomes by providing culturally competent care, addressing social determinants of health, and increasing access to care. And here's a bonus tip for you. Addressing implicit bias is critical in improving maternal health outcomes. And implicit bias are attitudes or stereotypes that can influence how healthcare providers perceive and treat patients from different racial, ethnic, or even cultural backgrounds. And these bias can lead to disparities in care and outcomes, particularly for patients who belong to marginalized groups. So to address implicit bias, healthcare providers need to recognize that they exist and consciously examine their own bias. This may involve training on cultural humility and confidence and regularly assessing and evaluating their own attitudes and assumptions. Healthcare providers can also work to create a welcoming and inclusive environment that acknowledges and respects the diversity of their patient population. By addressing implicit bias, healthcare providers can improve the quality of care they provide and help to ensure that patients receive the care they need to maintain good health and prevent adverse health outcomes. And lastly, download our free health equity practice guide to learn more about practical and effective interventions to prevent adverse health outcomes. Thanks so much for watching, and if you found this video helpful, please give us a thumbs up and subscribe to our channel for more healthcare content. Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.